So, Dr. Jerry Tan, today you presented at DERM Update on questions surrounding oral isotetinoin. Can you summarize why you do not use cumulative threshold dosing of 120 to 150 milligrams per kilograms?
The cumulative dose concept for oral isotretinoin was based on a previous limitation in daily dose use and duration of use, which basically restricted the amount that could be used to approximately 4 to 5 months of therapy at the maximum doses that were evaluated at that time, which was 1 milligram per kilogram per day. Now that translates at 4 months to effectively 120 milligrams per kilogram, or at 5 months to 150, which is how that range was determined. We have good data subsequently that patients who have more severe acne likely need much higher doses, probably beyond 200, 220 milligrams per kilogram cumulative. And those who have less severe forms of acne probably need much less in terms of cumulative dosing. So it is probably more clinically relevant and appropriate for individual patients to treat based on clinical response than to a numeric metric such as 120 to 150 milligrams overall. When we evaluated the literature to look for the quality of evidence supporting that information, we could only find very few studies, and there were 2 but low quality studies that suggested that that was a useful dose routine.
So, what type of approach do you take in your practice?
The approach I take is to treat the patients at a low daily dose that will maximize improvement but minimize the risk of side effects, monitor them on an ongoing basis, and then only stop treatment once we have achieved the absence of new lesions. And we treat them for 1 further month before we completely discontinue. And then I reassess them at 3 months and 6 months to ensure that their acne is still controlled.
That's great. Thank you so much.